Imagine your baby has a simple cold, but within days, breathing becomes a struggle. This is likely bronchiolitis, condition every parent should know about. Hey fam, it's Imperial here, a physician associate working in general practice in the UK. In this video, I will be discussing a viral illness known as bronchiolitis. We will look at signs and symptoms, risk factors. We also listen to the sounds that babies and young children present with. And finally, we'll be looking at red flags that you should not ignore. So stick around to the end. Bronchiolitis is taken from the word bronchial, which is a small airway in the lungs. As the name implies, bronchiolitis is an inflammation of the small airways in the lungs. It is a viral infection of the lower respiratory tract, affecting babies and young children usually under the age of 2 years old. Most cases are mild and usually settle within 2 to 3 weeks. However, some children may have severe symptoms and may require hospital care. Bronchiolitis is caused by a virus, most commonly the respiratory syncytial virus, which is known as RSV. Other viruses that can cause bronchiolitis include enterovirus, rhinovirus, adenovirus, and parainfluenza virus. This virus causes symptoms like common cold at the beginning with runny nose and a cough. Over the next few days, it can then cause the bronchial or the small airways to become swollen. This can make it harder for your child to breathe, and you may then notice symptoms such as noisy breathing, known as wheezing, and also difficulty with feeding. Around 1 in 3 children in the UK will develop bronchiolitis in the first year of life, and by the age of 2, almost all the children would have been infected with RSV. Bronchiolitis is particularly common during the winter season, and it is common to have infection more than once within the same season. Moving on to risk factors, there are things that can increase your child's likelihood of having this infection. One would be being exposed to smoke. This is common in situations where parents smoke and children are exposed to secondhand smoking. 2 is if there's an older sibling that goes to school or nursery. There are some things that can make your child more likely to develop a severe episode of bronchiolitis, or perhaps complications associated with bronchiolitis. Number 1 is prematurity. This can happen if the child is born under 32 weeks of gestation. Number 2 would be their age. If they catch this infection under 3 months old, other things would be congenital heart disease, which is if they are born with a heart condition or they have a lung disease such as cystic fibrosis. Others would include low birth weight or having a weakened immune system. Early signs of bronchiolitis usually resembles a cold, with symptoms such as runny nose or blocked nose and a mild cough, which then progresses to fever with a temperature of 38 degrees and above, difficulty feeding, fast or noisy breathing, also known as wheezing, child being irritable, and finally fewer wet nappies, which is a risk of dehydration. Symptoms of bronchiolitis tend to peak within 3 to 5 days, although cough may persist for up to 3 weeks. Now that we've looked at signs and symptoms, let's listen to some of the sounds that babies and young children tend to present with. There are no specific antiviral treatments for bronchiolitis. Care is mainly supportive. So at home, please ensure adequate hydration. Offer your child small but frequent fluid. When they are awake, try to sit them up. Other things will be to use nasal saline drop to help with nasal congestion, and also consider over-the-counter paracetamol or ibuprofen to help reduce their temperature and pain relief for any discomfort. Please seek urgent medical attention if your child experiences severe breathing difficulties, such as grunting in their breathing or chest wall recession, if they become blue around the lip or tongue, if they become very lethargic or unresponsive, or if they are having any pause in their breathing. Any of this sign is a red flag, so please seek urgent medical attention. I hope you have found this video particularly useful. If so, please like and share with friends or perhaps parents who may find it useful. Leave any question in the comment section and I'll try my possible best to respond. Kindly like and subscribe to this channel for more updates. Thank you for watching and bye for now.